Okay, camera's rolling. Anytime.
Hello. My name is Luann Lonergan, and I'll be a registered nurse today. Can you tell me your name? Mrs. Smith. Good. Can I check your armband? Wonderful. And can you tell me your birth date? Good. Mrs. Smith, I understand you've been having a little bit of discomfort with that Foley catheter. Okay, that happens sometimes. So I did check. We've got a doctor's order. We're going to irrigate that and see if we can't get that working a little bit better. Okay? Are you having any discomfort? A little bit of discomfort? Okay, so I've got my supplies ready here. I'm just getting the bed up and we'll get going with that. Okay, good. So I'm going to just pull this back a little bit and I'm going to just put on some gloves. You know, I'm just going to lift it up a little bit more, Mrs. Smith, and I'll cover that up a little bit. I'm paying attention to the urine in the tube, and that looks a little bit cloudy. I see a little bit of sediment. And another thing I'm going to check here is that bladder. Yep, I can feel that up here. You can feel that. Okay, so first thing I'm going to do is just take this out here. So out of your stat lock, so I have a little bit of room with that. Good. And I'm going to just cover you up a little bit here so you don't get cold. All right, good. So things look pretty good here. And I'm going to come back over here and look what I've got. I've got an irrigation tray and I want to check the expiration date. Yep, and it should be all intact. So I'm going to open that up here. There we go. I'm going to take that off. And I want to keep the inside of that bin sterile. So I'm going to just lift out here. Very good. And then I'm going to dump out what I've got in there. So it's the inside of that bin that needs to be sterile. Good. I can move this over here. And now I want to do, I've got to be careful to only touch above this flange because below that syringe is sterile. And I'm looking, I've got bladder irrigation. This is normal saline. And it's labeled, and this is good just for 24 hours. And I just opened this one, or I just grabbed this one, so this should be good. So I'm going to look at that label about 3 times, bladder irrigation, and I'll look at that one more time. I'm going to take off the cap and keep it upside down off to the side. And I'm really going to I've looked at it now a 3rd time, and I'm going to pour enough of the irrigant, and that should be, again, I've got a doctor's order to do this. Wonderful. And I'm just touching on top of that. What I want to do is I want to pull up about 30 cc's, being careful not to touch the inside of that. I'm going to look to see. We're almost there. Okay, so I've got a little bit of air there, so I want to turn that syringe over and just gently get out that air a little bit. Push on up. There we go. Good. All right, and again, I'm being careful not to touch that syringe anywhere on below that flange. For the purposes of this demonstration, because of the model, we're going to squirt out all of that normal saline, and I'm going to just withdraw some air, so 30 cc's. But for a real person, we would use the normal saline. Now what I've like to do, I've got this barrier, and I want to protect the bed. So again, the shiny side down. Okay, Mrs. Smith, how are you doing? Wonderful. So I'm going to just put that under Mrs. Smith just to protect the bed so we don't get that wet. Wonderful. All right, now what I'm going to do is I'm going to put this off to the side here because the inside of that container is sterile. Now I'm going to move what I've got. I've got a couple of things here. I've got some alcohol pads. I'm going to move over here, and I've got a drainage protector and catheter plug, and I'm really going to be using the protector cap. So I'm going to open that up and get that ready to go. Okay, Mrs. Smith, what I'm going to do is I'm going to just, this junction right here, so again, I took it out of the stat lock, and the junction here, I want to wipe that very well. Beautiful. I've got this I can dump out. I'm going to take that out, and I'm going to take this off, and I'm going to actually clap that there, and I like to move this so it's just barely, there we go, so it's not touching the inside. This cap now is protected, and that is sterile. So now I'm set. I can set this off to the side if I need to. And now I've got my irrigation, so I'm going to put my thumb here, and again I've got about 30 cc's. So what I'm going to do is just come here, and I'm going to gently instill that, keeping the tips very sterile. Okay, so I'm going to go very slowly, about 3 mils per second. There you go. How are you doing, Mrs. Smith? Good. That should be, and what I'm going to do then, take that out and let that drain. And then I can go back here. Do you see where I'm touching? I can go back here, withdraw some more fluid, and do that. Let's say that this would not come out though. Nothing is coming out. I can try a couple of things. What I can do, again, with this irrigation system, I can go back in, keeping that tip very sterile, and I can aspirate. See if I can get anything. Very good. I can also have Mrs. Smith just sit up a little bit, move her hips ever so slightly to try and get that position. But let's say I got some urine coming out, which is good. So I can undo that, put that in here. I would then squirt that in. And again, I could keep irrigating until I get clear returns coming back, or clear urine. I have to make sure that I'm keeping track of how many times I'm going in, so I know how much actual urine output was there. Now the last step that I need to do is I'm going to clean both ends, and I like to, again, to pull back that port, so this one is very sterile, the tip, and I just drop that. I'm going to open that other second one up. Beautiful. So I've got to make sure that these ends do not touch anything. So I get it very close, and I want to get it over that lip. There we go. And then I can scoot it up, but being very careful not to touch the plastic part because that's sterile. There we go. So those edges remain very sterile. Okay, so that system should be flowing better. I'm seeing some urine come out of here. So really what I can do for Mrs. Smith, I can put this I'm going to just make sure it's over here, and I'm going to be able to empty that and record what I've got. But I want to put this back in that stat lock here. All right. All right, so she's got some wiggle room there. How are you feeling? Better? Okay, so I'm going to kind of watch that returns and make sure that that comes on out real nice and clear. And I will then monitor. So I'm going to empty this out in the bathroom, and I'll have to subtract what I did irrigate here. So I'll lower the bed as I leave, but first I'm going to empty this out in the bathroom and again get rid of all my supplies. All right. Put the bed down then for her, and this is all good. All right, thank you, Mrs. Smith. I'll put on some new gloves and take that out and measure that.